Assalamu alaikum guys. I'm a final year medical student at Khyber Medical College and I've cleared my USMLE step 1 exam and currently I'm preparing for the step 2 CK. This particular video is dedicated to all the first year juniors who got admission into medical college this year. First of all, I want to congratulate them and their family for making it into their dream profession and dream institution. What I want to talk about in this video is how to approach medical school or medical college in the first year or the second year of medical school. So there are two approaches that are used here. The most common one is the traditional way of learning medicine, which I also called as the passive way of learning medicine. Where you use lots of passive resources for learning medicine, like large textbooks, going to every lecture, and making notes of all the stuff that teach you in lecture. And this traditional way is absolute like waste of time. It's only like gonna benefit you 5% or 10%. The other 90 to 95% is absolute waste of time. The second way is what I call the USMLE way of learning medicine, or the active way of learning medicine, where you do lots of question banks, you do lots of questions, lots of clinical scenarios, lots of problems, you solve lots of cases. You do active recall like flashcards and Anki. You do active reasoning and discussion with your colleagues, and you only focus on those clinical aspects of learning the basic sciences. Like, let's say if you're learning physiology, you should ask question, how can that benefit me as a physician or as a surgeon? Same goes for biochemistry and anatomy. And same goes for like embryology. I don't want you to follow all the large textbooks like, let's say, Get Physiology, Pankaj Biochemistry, or some Chatterjee or something like that. I don't want you to follow like Gray's Anatomy or let's say KLM for embryology. This is absolute waste of time, and I don't want you to waste time. I want you to learn medicine right from this beginning, right from the start of medical college, and do as many questions, as many scenarios, as many cases, and only focus on those clinical aspects of learning these basic sciences. Now, of course, it's gonna be longer for a single video. I cannot explain every single aspect of that approach, but I'll make videos in near future for those how to actually approach the first year and second year in a medical college. So stay tuned for those, and yeah, stay happy. Thank you.